The KwaZulu-Natal Health Department says the number of confirmed cases of hand, foot and mouth disease in the province now stands at 168. The eThekwini District has 120 cases, followed by King Cetshwayo District with 25, UGU at 20 and uMkhanyakude District with 3 confirmed cases. The department says all the infections recorded emanate from primary schools and daycare centers. Officials say the first 6 cases were actually recorded a week ago, and officials have been visiting affected schools where pupils were found to be suffering from flu-like symptoms as well as blisters and swollen hands.
The KwaZulu-Natal Health Department in the province says that the number of cases of hand, foot and mouth now stands at 168. Where we are in Phoenix is at Lenman Primary School, which is said to have the most cases. Now, the eThekwini District has 120 cases, followed by King Cetshwayo District with 25 cases, UGU District at 20, and uMkhanyakude District with 3 confirmed cases. The department says all the cases recorded emanate from primary and daycare centers. Officials say the first cases were reported 6 days ago, and they saw many learners were found to have flu-like symptoms as well as blisters and swollen hands. Now, we have been speaking to some affected parents who are still in the dark and unsure whether they should bring their children back to school. I see one parent is standing outside the school, and she was talking off camera, just telling me that her daughter suffered with hand, foot and mouth disease for the past 3 weeks now. I'm joined by Zoe. Zoe, thank you so much for talking to us. Just take us through some of your daughter's symptoms when you first started seeing her displaying these symptoms.
Ngambona nje 3 weeks back esikoleni ezandleni she has blisters. She said it's hurting, she couldn't write, and then it was also on the palms. She couldn't sit, on her foot as well, so I took her to clinic. So in clinic they gave her injection and a treatment as well. So now it's clearing up bit by bit. Now she's completely fine, but at school they're rejecting her because they need a certificate that she's been healed.
When you took her to the clinic, did the nurses know exactly what these symptoms were? Were they able to tell you that it was hand, foot and mouth disease?
Yeah, I think they knew because they just asked, they just checked the mouth and the hands and the foot as well. So I think they knew what they were dealing with.
Did you know it all?
No. Because lentole bomvu, and it was so confusing and it was hurting. And it was growing like growing by night. Ngoba namhlanje bingcono and then ngakusasa kuseni isi worse. Yeah.
This particular school, Lenman Primary School, has the most cases. Do you know of any other parents who have spoken about their children also suffering from this viral infection?
No, not really. I don't know anything. She just called me about my children. Yeah, but the thing is, my boy is also being isolated, but she don't have blisters because they're twins. Okay. And it's affecting them because they're missing school.
How long has your children been out of school now?
3 weeks now. It's 3 weeks now. They're staying at home for 3 weeks because they don't have a certificate. So now I have to go clinic and ask for the certificate.
The community where you reside in here in Phoenix, are there other children who are also displaying symptoms?
Yes, most of it's in my creche. Even though abazali babo ngingabazi, but ngiyibone ingane shem izandleni sinazo.
And has the school sent out a circular just notifying parents of the do's and don'ts and what the symptoms are?
They usually do. It's just that WhatsApp now, so they always send my WhatsApp on groups to see what's going on. So now WhatsApp, so angazi lutho.
For parents watching at home, and I imagine this was very distressing for you when your child came home with these symptoms, talk to us about what you did to alleviate the pain.
Ukuthi nje umphuzisa iPanado, umgeze ngosawoti. Yeah, that's it. Other than it, injection because she got better after injection.
And it's been 3 weeks now. They say that symptoms usually last between 3 to 10 days. Has she still got some of the blisters?
No, she don't have anything now. She's completely fine. They just need a certificate. That's it.
So thank you so much for talking to us. Well, that was one of the affected parents here in eThekwini, here in Phoenix, at Lenman Primary School. You heard her saying that her child started displaying symptoms 3 weeks ago. She is still waiting to get a certificate from her doctor so that her child can come back to school, but saying that it was a very difficult, time, that the child has been isolated. She does have twins. Both her kids are now at home, and just saying that she's still in the dark with regards to when she can bring her child back to school.
Jayed Paulse there reporting from Durban.